For anyone over YouTube, welcome as well. Again, our workshop today is really test taking strategies with kind of a nursing bent. And we have a couple other videos that touch on other kinds of test taking strategies. This is more generally test taking strategies, including, what you can be doing kind of the night before a test, the morning, the moments before a test, what you can do after a test. And this is maybe the even bigger picture of what can you be doing over the course of a whole semester so you're set up to succeed in that test. Nikki and I today are talking more so of like, what are the strategies to make it so the test itself doesn't get in your way, so that you can focus on what you know and the structure of the test isn't an obstacle because you're familiar with it and you've kind of some test taking strategies.
In terms of test taking strategies, the NCLEX is all about the science, but it also is really important that we understand how to actually approach the question. And my specialty being NCLEX remediation, but of course, remediation meaning that these are repeat test takers. So we're really looking at students that have failed the NCLEX more than once and therefore need remediation of the science, but also need to be taught how to approach the questions. So again, there's really no substitution for knowing the material, but understanding how to take apart a question is very important. So the method that you're looking at on this PowerPoint right now has to be done in order. It's very important. The very first thing might sound silly, to read the entire question. But sometimes we get so focused and sometimes super anxious about the test in general that we tend to speed through or we skip sentences. Or I've even had students tell me they literally look at the very last sentence first. That's not going to get us where we need to go. So step one, read the entire question. Step two is ask yourself, what is this question asking me? The other times that we sometimes get stuck is we actually don't know what they're looking for. So if we answer this in our head, what is this question asking me? Then we can feel confident that we have a base for what the question is going to be about. Step three is to go back in the question and look for relevant data. I can't speak for anything outside of nursing, but I suspect there's commonality here. The idea that the test questions are meant to be tricky. They're meant to give you sometimes extraneous data that doesn't really matter in the end, but they also are giving you clues about certain things that really do change the entire look of the question. In regards to nursing, sometimes this means gender, sometimes this means age, sometimes it's a specific symptom, but all of that is relevant and needs to be a part of our thought process when we're pulling apart this question. Step four is to answer the question in your head. Now, you'll notice that I did not say at any point yet to look at the answer choices. We're not even there yet. By answering the question in your head, sometimes this helps us to narrow it down between two answers. It also helps us because a lot of students say, well, I can get it between two. But then, depending on what those answers look like, I get talked out of the right answer. So, by answering the question in your head, for example, if I say, I am positive the answer is potassium, and then I look at the four answer choices because that's number five. Now, look at all the answer options, and potassium is my actually there. I'm still going to narrow it down to two, but I'm going to say, you know what? I said in my head this answer is potassium, and I felt confident that was the answer. And potassium is there, so I'm going to choose potassium. And that really helps to um, help us not get talked out of the answer when we knew what it was. So that's that one. Making your answer selection that most closely answers what the question is asking, addressing the relevant data, and answering what you felt the answer was initially will also help you to gain confidence that you have this answer correct. So that's the way that I usually have the students approach each question every single time. So if we look at question 25, the one that's on our slide, a patient with atrial fibrillation, which is a rhythm problem of the heart, is ambulating in the hallway. Ambulating means walking on the coronary step-down unit. So this is a patient who has a heart problem, and the coronary step-down unit is a higher level of care. So we're meant to understand that this is someone who's got a heart problem that's pretty decent because he's not in the intensive care unit, but he's not in a regular unit either. He's somewhere in the middle. And suddenly tells you, I feel really dizzy. What action should you take first? Well, we read the whole question, right? The next thing was, what is this question asking me? What action should you take first? Another way to interpret this is what is the priority? Because it says first. First is priority. So then we go back. Now let's talk about the relevant data. Well, atrial fibrillation is relevant. The fact that he's walking is relevant. The fact that he tells you, I feel really dizzy. Those are all very important. Coronary step down unit is important, but less important than the others. The way I interpret that information is, again, he's not so sick he's in the intensive care unit, but he's also almost there because it's intensive care, step down, regular floor. So he's not super stable. So those were the relevant data that we took out of the question. Now, if I'm answering it in my head, I'm thinking safety. He's saying he's feeling dizzy while he's walking. So if my patient is walking and he feels dizzy, what could happen? I'm thinking he's going to pass out, but he's walking, which means I'm worried about him falling and hitting his head, falling and breaking a hip, some sort of injury associated with falling. So that's where my thought process is. What action should you take first? My first thought is something related to safety. So now I look at my answers. Number 1, help the patient to sit down. So I said I'm looking for a safety action. 1 is a safety action. So I'm going to keep that. Number 2, check the patient's pulse. An apical pulse is their heart pulse. I could do that. I'm not sure that it's an action that makes them feel safe. So I'm going to say no to that. Take the patient's blood pressure. It's important. I do need to know blood pressure, but does it address safety? Not exactly. So I'm going to rule that one out. Number 4, have the patient breathe deeply. Now, this is something that you'd have to understand the science to know. Breathing deeply has absolutely nothing to do with AFib. They're not related. So right away, I'm going to say not only does this not answer the question, it has nothing to do with the diagnosis or feeling dizzy. It's completely irrelevant. So I'd cross that one out. Now, I didn't even really have to do 50-50 here because there was only one answer that actually answered the question, and that's number 1. Because 4 was completely off, and 2 and 3 are not actions that make me safer. Only 1 is. And that's how I would work that problem out.
So just like Nikki talked about finding the relevant data, a way I sometimes frame this too is like, can you find, instead of wrestling with this question that's hard to wrestle with and it's like 16 words, can you keyword it? So what that is really almost like tunnel visioning. And I'm just going to focus on only the most important or even like the most specific words. I'm seeing numbers. I'm just going to highlight it. They're specific. Passage 1, passage 2, conclusions. Students, I think, also pick out this one.
Yes, for sure.
Yeah. So genuinely check it out. Difference, conclusions, passage 1, passage 2. That is so much easier on my brain. And I really feel like I know what this is asking now. You can also like paraphrase a question back in your head, especially if you're like, I still don't know if I get it. To be like, wait, is this asking me? So with this one, it's like, okay, passage 1 is saying something, passage 2 saying something different. What's passage 2 saying different? Once you know that, you can do the same thing with answers 2. So if I was doing this Nikki's way, I'd probably be like, wait, I'm gonna, before I look at the answers, guess what do I remember? What do I think might be the difference between these passages that I read? After I do that, you can keyword answers just like questions. So that could be here like, hey, lighter sentences for violent criminals. B, argues increasing education, something, something. Help reduce crime. Blames politicians instead of pundits to increase criminal. But you get the idea. What you can even kind of visually see is a lot of answers, you can almost cut them in half. A lot of answers are compound answers. And what I can do now from keywording the question, maybe paraphrasing it back, picturing, trying to pull back my brain, what do I think is the answer to this. What I now can do is almost treat this like a bunch of small true false questions instead of wrestling with the like 16 words up here, eight answers, 8 word answers each that are compound and complicated and getting stuck somewhere. So what I could do is go like, okay, I'm looking for the difference in the conclusions between passage one and passage two. So true or false, did that passage one talk about lighter sentences? False. Did it talk about violent criminals? Maybe, I don't remember. Did passage two talk about increasing educational something something? Yes. Did it talk about reducing crime? Yes. And so by doing that kind of tunnel vision, almost one word, one couple words at a time, instead of getting lost somewhere here or lost somewhere here, I'm now kind of pretty naturally this tunnel vision and true false my way through it. I feel like I got a little abstract there. Nikki, did that make any sense the way I just described it?
Yeah, I think that like chunking the things together matters. Like the other thing I was thinking of when you were describing it with letter A is I was actually going to say recommends. And the reason why I was going
Sure.
to say that is because in some of the nursing tests, the question will say, what did the patient say that requires further education? So when this sentence is worded in this way, we are meant to understand the answer should be wrong because it says the
Sure.
patient said something that requires further education. So when I read A and I heard recommends, I was like, okay, sometimes actually they say the opposite. And then that's again, you have to read the question. Because if you don't read the question and ask yourself, what is it even asking you, you're going to get it wrong. Because in the question is asking you for a negative answer and you choose a positive, then you already missed it.
That's another great keyword, great piece of relevant data. Which of the following is not a priority, right?
Right.
Like if I miss that
Yep.
one word, I've seen students do it, that totally, unravels.
Yes. Changes everything. Yep.
Yeah, because this is one other question. We can just keyword it together. That would make this maybe a little more concrete. This is a question from an old copy of the NCLEX. So here's the question. 16-year-old with cystic fibrosis is admitted with increased shortness of breath and possible pneumonia. Which nursing activity is most important to include in the patient's care? Can I ask you first, Laura, and then you, Nikki? Because Nikki, you'll know the special nursing words too.
Hmm.
I don't think that the age, I know that cystic fibrosis patients are young, so I don't know that the age matters.
You
It's a
got it.
number.
Sure does
Yeah.
not, because life expectancy of a cystic fibrosis patient is under 21.
Okay.
Therefore, the age is not relevant. That's correct.
I'm
Okay.
still going to highlight it because it's a number, and I like numbers. If Nikki, are there any other words you see here that you're like, oh, those are important
Yep.
for specific?
Increased shortness of breath,
Nikki,
pneumonia, nursing activity, most important. So this is once again a priority question. There are answers here that all are important to this patient, but by definition, only one can be most important.
yeah, I hear it all the time. This is with folks that did nursing exams, but also in some of the other programs, they have this most important, and students across the board data. But it's tough, right? Because now some of these might be true, but if they're not the most important of a true thing, then we gotta.
But this relates to practice because, in this NCLEX world, I have this one patient. But what if I have 6 patients and they all need something? Otherwise, they wouldn't be in the hospital. I have to figure out who do I need to see first out of those 6 patients. And then, depending on which patient I choose, what do I need to do with that patient as a priority? Because I don't have all the time in the world. And if I spend 3 hours with this one patient, what about the other 5? So understanding how to prioritize is a critical task for a nurse.
We've keyworded most important and double keyworded it. I'm even honestly going to kind of go almost fast through the answers, just almost visually again cutting them in half. So perform postural drainage and chest physio something.
Physiotherapy.
Allow the patient to decide aerosolized medication. Place the patient in private room. Decrease risk of further infection.
Mhm.
Plan activities to allow. 8 hours of uninterrupted sleep. And again, this one really it's compound answers. You can cut them in half, you can keyword them, and then you can start true falsing them. So the answer that I have for this one in my answer key that I need, because I don't, is A.
Absolutely, because it says most important.
Yeah.
Does B, what do you think I'm going to say about B?
So,
The 16-year-old patient. Allow the patient to decide whether she needs medicine.
so that 16-year-old kind of a little bit came into play, no? Because it like, yeah, allow the patient to decide they're 16 years old for sure. No, we're not going
Yeah,
to do that.
absolutely not. Right.
Plan activities to allow for 8 hours of interrupted sleep.
It's
So
not terrible.
We all need
But
to.
you wouldn't be in the hospital if you weren't sick. So is it realistic to say anybody in the hospital gets 8 hours? I would love to meet that patient.
and if I, to me, not in the nursing field, I'm looking okay in 8 hours of uninterrupted sleep. I just don't see it connecting to any of my relevant data, any of my
Right.
keywords.
Doesn't.
What does it have to do with it?
Right.
Same
It
thing for
doesn't.
me with C. I'm like
Mhm.
private room, maybe this.
Right. So I would have kept that for sure, because if we're ruling it between 50-50, I'm going to keep C because of the fact to decrease the risk of further infection. The problem is that we really wouldn't do C in the real world because the patient herself is not um likely going to qualify for her own room.
And that's the knowledge part that, again, we're trying
Right.
to make the test not get in the way of the knowledge For me,
Mhm.
just on the test taking side, I'm not in the nursing field. I genuinely don't know the actual like nursing material, but
Mhm.
I immediately lean towards A, and it's really just because the keywords in A are almost matchy to the keywords that I've zeroed in
That's
on
true.
the
Yep.
question. And this is a thing you will genuinely see. I've seen it in NCLEX questions, GRE questions, where when the keywords to an answer are that matchy to it, the keywords I picked in the question, it's a pretty good sign. And
Mhm.
also by doing that keyword, I didn't get stuck in the question. I was zeroed in almost one stepping stone at a time. And so I got rid of these that they're not, it's not that they're absurd, it's just they're not that related to the keywords I was looking for. I'm going to keep going to my two last, just like test taking survival strategies. This one is especially good for um, if you're ever like between two answers, like Nikki talked about, you've done the process of elimination, you're down to two. And I always want to be like careful with how I first describe it because it takes me a minute to describe this strategy. The idea of it is that like when I see this question and then go to the answers, my brain almost starts to start making reasons why each one could be true and why each one shouldn't be true. And then I go back and forth and I get stuck. So with this, the idea of the strategy is for the answer choices, especially if I'm between two, but even if I'm between a couple more, is I'm gonna I'm gonna say, okay, A is true, B is true, C is true. What does the universe look like in which A is true? And I'm gonna almost play that scenario out a little bit. That B is true. What does the universe look like where that's true? Like what happens in that universe? I'm gonna play it out a little bit. Same thing with C. And what that starts to do is make the differences between the answers feel a little bigger, and you can start seeing like what's wrong. Right. Here's I'll do it kind of with the real question to make that a little more concrete. This question is from a social work exam. So it's, a social work therapist. And the question is the key to systemic desensitization. So I'm in social work, I'm trying to make my client less sensitive to something. And I'm going to say each of these is true. What does this universe look like? What do I picture when I picture this being true? So I'm a social worker, and I'm going to picture a universe where social workers teach their clients to avoid fear-producing stimulus. So their social workers say like, okay, here's your tips for how to avoid spiders. If you're afraid of spiders, I immediately start feeling like something's wrong here. Like, why am I getting lessons on how to avoid spiders from my social? I feel like this is just everything's kind of backwards. I should be getting less sensitive. This is going to make me just more worried about spiders. So I'm going to picture that this is true, a universe where social workers, the way they make people less sensitive, their clients less sensitive, is they rapidly progress them through the fear hierarchy. I immediately keyword this, and that seems really worrisome to me because then we're going, why are we going rapidly and fast? And aren't we going to accidentally mess something up? If you know social workers, they tend to take their time and be careful, especially with fear, because you don't want to mess something up. These two answers on the page look really similar, right? So A, we're going to have our client maintain relaxation while being exposed to the fear-producing stimulus, or we're going to have our client maintain relaxation while imagining the fear-producing stimulus. So pretty close on the page, but if I start to say, okay, this universe is true, where social workers have their clients maintain relaxation. So I'm going to picture that. I'm going to imagine that scenario. So they have like a client and they're sitting and relaxing and like imagining spiders. Maybe it doesn't sound too bad. Or I'm going to imagine this is a universe where social workers, they have their clients sit and kind of maintain relaxation, and they bring in a box of spiders. 100% no. Or like they bring in like a bobcat, or like, like for sure no. I, I think Nikki can back me up on this, that with nursing, or especially it's really scenario based. It's
Yes, very
something
much so.
laying out, wait, what happens if I picture doing this? Like, and then
Mhm.
the differences start to feel bigger, and things start to feel worse and better, especially if you're between two, but even if you're between three. Here's my last test taking survival strategy, which is you can always turn questions into just true false questions. We talked a little about this. Um, Up here, we can admit that person if we want, of treating like the different pieces of answers like smaller true false questions. This is especially a useful tool for any of the select all that apply.
Mhm.
Nikki, I feel like students don't like the select all that apply. Is that true in your?
They hate them, mostly because it becomes a fear-based thing,
Okay.
because if I don't get every single answer correct, the whole thing is wrong.
Yeah. No.
In nursing school, that is true. So, for example, if the answer was 1, 2, and 5, and you said 1 and 2, the answer, you got it wrong. For the actual NCLEX, they do give partial credit. For example,
For
the
sure.
answer was 1, 2, 4, and you only said 1 and 2, you get credit for 1 and 2, but then you don't get credit for the fact that you missed 4. Nursing school doesn't give partial credit, which is a correct thing. We shouldn't. We should be making sure you know the material truly. And that's a part of the fear with the select all, is if I miss just one, the whole thing is wrong.
As soon as I see select all that apply, to almost stop paying attention to it, and now to treat it like I don't have one question, I have 1, 2, 3, 4 true false questions, and to kind of cut them through like that. So now I'm not paying that much attention to the scary select all that apply. I'm saying I have 4 true or false questions, and the two things I'm asking are true or false, and does this connect? Does it actually answer the question? I'll spend more time maybe with this one, which is a real select all that apply for a nursing question. So what's this question? The keyword too. The nurse in the mental health unit, right?
Mm-hmm.
Plans to use therapeutic communication when communicating with the client. Select all that apply. So now I'm going to treat this like a bunch of true false questions, and I'm just going to double check that they also answer the question. And that's my two jobs. And that's kind of what I'm going to zero in to focus in on. True or false, restating. I feel like true. What does that look like? If I imagine that.
This one's a super tricky question,
Yeah,
because therapeutic communication with mental health patients is completely different than medical patients.
got it. Yeah.
Like, so as here's a test taking strategy for you. If I see that this is a patient, for example, mental health, schizophrenia, or bipolar disorder, when I tell the students, when they're looking at therapeutic answers for this, with a mental health patient, the answer is always going to address the emotions behind the words, not the words themselves.
Yeah.
Versus medical therapeutic communication will be some form of, do you want to talk about it? So, for example,
Mm.
if the patient who's a medical patient, they've had a heart attack, and the nurse walks in and he says, "You're the worst nurse that I ever had. I never wanted to see you again." Now, this is a medical patient. The
Right.
answer is some form of, do you want to talk about how you're feeling?
Sure.
But if it was a schizophrenic who said this to me when I walked in, I address only the emotions, not the words themselves. So I would say something like, "I hear you're feeling angry."
So there is some restating. No, I
From
don't.
from a way of the emotions, not the words. We never use the actual words themselves. We address the emotions behind the words for mental health.
That makes sense.
So active listening for sure, yes.
So
I
how
would not
about
say
listening?
why, because why is not addressing emotions, why is addressing words.
Got, and to me, I feel like why just is always going to open a can of worms of like,
Correct. Yeah. Generally, why is not a good idea.
Maintaining neutral responses, true or false. And I'm going to go back to make sure I'm answering the question. Therapeutic communication. That seems okay to me. Is it
It
okay?
is good. Yeah, for sure. Hmm.
True or false, therapeutic communication, providing acknowledgement and feedback. That sounds pretty good.
Yeah, acknowledging, such as, I hear you feeling angry. I'm acknowledging that you're upset about something. So, yes.
So, true or false, giving advice and approval or disapproval. And we're looking for a therapeutic communication. I would lean false, but again,
False.
yeah, cool.
False,
How did I
because
get it
we
right?
are not doctors, so we can't give advice. Secondly, approval or disapproval means I'm going to invalidate your feelings. So you're angry and you say to me, "You're the worst nurse I ever had. I wish I never see you again." And then I can approve that statement. You're right. I'm terrible. Or I can disapprove, like, I'm not the worst nurse. There are way worse nurses than me. None of that's therapeutic.
This is a question I didn't notice until we started working through where two of the answer choices actually give me kind of clues. We're like, if this is true,
Right.
maintain
They cannot
I
both
should,
be. That's
yeah,
right.
yeah, and I don't think I have that on the page to talk much about, but you sometimes do see that too, where one answer choice actually gives you a clue, like only one of these can be right. So which
Absolutely.
do I think this is right, or do I think this is right? But again, it's just a bunch of true false questions. I'm not sweating this and taking it kind of again that kind of one step at a time. My
Hmm.
big pitch really with test taking strategies is that brains don't like having 16 words thrown at them and then 8 words apiece for answers and somersaulty sentences. So it's how can
Hmm.
we break it into smaller chunks and just
Right.
do it with one small chunk at a time.
Especially if you're someone who struggles with anxiety, you really need to break those questions down further because all the words on the page and your brain just sort of sees this versus individual words. You see like everything's together, and that's not going to help you.
Yeah, I can tell you with the nursing students I've worked with, the students just in for other tests, the things Nikki and I just talked about, they're the things that like one notch at a time start get
Yes.
the higher grades because it
Mhm.
makes it so the test doesn't get in your way and the content you already know, you can kind of just focus on that part. Because I know students talk about these two kinds of questions,
Mhm.
unfolding case studies, Bowtie questions. We have a couple examples here too. Are there things that you'd want students to know most about with those two kinds of questions? They're a little more complicated, but a little tough.
They are. This picture that we're looking at here is an example of a case study where it's a situation where we have a patient, we have a diagnosis, signs and symptoms. In this particular case, we also have some lab values in the blue box. And then the test will ask you questions that pertain to that situation. So, with a case study in this one, you have 7 questions that pertain to that exact situation. But on our tests, or especially on the NCLEX, the case study evolves. So if we were to turn the page in this book, we would likely see a situation where this patient is named Mr. D, that Mr. D's condition has changed. And they will tell you this is what his vitals are now. This is what his blood sugar is now. This is what his mental status is now. And then they'll ask you a question based on his change in condition. So you're always given the case study that you started off with. And then in that case, you're given an update. So you don't have to memorize the case study. It's always there for you. But you're meant to answer questions that pertain to this situation versus just a single sentence like your 16-year-old with cystic fibrosis. All you had was shortness of breath and pneumonia. That's all. But if you look at this, we have a history of how long the patient's been symptomatic. We have data points, blood pressure, blood glucose, and respiratory rate. And if we turn the page, we would have additional data points, which will help us to answer questions like, for example, did your interventions work? Or is the patient improving? Or it's not working and they're deteriorating. And so that's what the case studies will look like, where you have several questions that build upon a specific study in the beginning, and then the patient's condition changes.
I know Nikki and I talked about this, but even because this is kind of from in my world almost like a reading passage
Mhm.
type question. And my pitch to students whenever you see something like this is when you first read a big chunk of text like this, you're not trying to memorize it. Just like you said, you're almost I always say like trying to almost map the information in the back of your brain. Just let the
Mhm.
back of your brain take note of where information is. in this passage because you'll have it for each one. So then it gets even more helpful to keyword like this question to clarify pertinent data. What question? Oh, so what questions are we going to ask? And now I know where to kind of look back in the passage because I just let the back of my brain vaguely map out where stuff is. I know where to look to start answering this question and to do exactly the strategies. The bow tie questions, they're kind of new, no?
They are. They're brand new. Case studies are somewhat new for the NCLEX. Their unfolding case studies are brand new. That's that where the condition changes. But these bow ties are brand new when the test was updated last year. So if you look at this, we still have our little case study on the left, nurse's notes, and there's a time, and there's a whole situation of all the data points, the history of the patient's condition, and then the question is on the right. So this bow tie is what this question is. If you look at the question, and again, this is where you've got to read the question. Complete the diagram by dragging from the choices below to specify. Now it tells you what condition the patient is most likely experiencing. That's one. 2 actions the nurse should take to address that condition. That's 2. And 2 parameters the nurse should monitor to assess the patient's progress. That's 3. So if we do it in order, it says what condition first. So we have to start in the middle and pick a diagnosis based on this case study, and we're going to drag it up there. Then it says 2 actions the nurse should take. So that's on the left. So I'm going to choose 2 actions that are related to that middle diagnosis I chose that also pertain to the patient's situation. And then on the right, I'm going to 2 parameters and drag those, which are based on diagnosis, the actions you decided, as well as the patient's history. And then basically 2 parameters to monitor, like how will I know if my actions were successful? That's what the parameters show. So it's important that you're doing this in order because if you start with actions and you don't even have a diagnosis, you're going to get yourself confused.
And then is this kind of otherwise similar to a reading passage where I'm not trying to memorize it, I'm just trying to map out the information and then
Yes.
pull kind of back and forth almost?
Correct. You will have access to that study for sure. And it even tells you at the very beginning where your general direction is. Pediatric unit 6-month-old. So my brain can instantly say, okay, whatever this is about, it's peds. I know that a lot of you are not in nursing, so I hope that you still appreciate that the steps that we talk about to break down these questions really can be applied to anything. So I hope that you still were able to apply this to your own major, and I wish all of you good luck.